As I promised you in the beginning, so today we will see I will take you through the best practices in the field of policy management, and I will show you the different phases involved in an effective policy management process, specifically tailored for healthcare organization. I'll introduce myself again. I am Tinu Kurian. I am talking all the way from Doha, Qatar. I am working as a policy analyst, policy coordinator in one of the healthcare organizations based in Qatar. Today's learning objectives are listed here with. By the end of the session, you will be able to see, or you will be able to understand the importance of policies and what is called a matured policy management structure. You will be able to see or be able to define what are the policy management principles and what are the different policy management capabilities. And you will be able to see what are the different phases or steps in policy management throughout policy life cycle. And at the end, you will see how policies or internal regulations act as an enabler of governance, risk, and compliance elements in an organization. So these are the learning objectives for today, and this will be the topics I'm going to cover in today's session. So I'll introduce you to policy management. There we will see the importance of policies and importance of policy management and what is policy management life cycle. How can you govern a policy management structure and different phases or different steps in policy management, starting from the development and approval phase until the effectiveness analysis and improvement of policies in an organization. So all of you know what is policies, right? Policies are basically laws, rules, or regulations in an organization. So it will help an organization to define or articulate and communicate leadership expectations to their staff. So by having a policy, the leadership team, what they are trying to do is they are trying to define and articulate their expectations from their employees. It will help an organization to communicate their risk limits, because policies are also known as internal controls for risks. So we will dive deep into the details of these terminologies and these statements in the upcoming slides. Don't worry if you don't understand the concepts fully here. Here I am just introducing you to the the importance of policies and policy management in an organization. So it will help an organization to obtain its business goals, objectives, etc. And it communicates the desired behavior or conduct of an employee. So this is why policies matter. So these are the importance of having a policy in place. And an organization, any organization that fails to establish strong policies, they will fail to attain their overarching goals and objectives. If an organization doesn't have a policies and procedures in place, they will soon fail to establish or soon fail to achieve their objectives. And moreover, policies are critical in managing risks, because every policy document is a risk document. As per the current best practices in the field of policy management, policies are considered as risk documents that aims to control risks in any organization. So by establishing or by implementing policies, an organization is trying to control its risks. Okay, policies also define boundaries for the behavior of individuals. It will tell you what are the do's and don'ts. It will tell your employees what are the do's and don'ts when they carry out their day-to-day work. It also ensures clarity and consistency of action across the organization. It clearly defines employees and managerial responsibilities. It provides employees with the necessary autonomy to make decisions about their work within defined boundaries. Okay, so these are the importance of having policies and procedures in place. Okay, so if you have a policy in place, for example, how policies are defining, or how policies providing employees with the necessary autonomy to make decisions about their work. I'll give you an example. For example, me as an employee in an organization, I want to take my annual leave, and I don't know the process. If there is no procedure and policy in place, how will I know the step-by-step process of applying for a leave? Either I have to go to my supervisor or to my colleague. That is a time-consuming process, and we never know what process they are going to explain to you. So it is always good to have all these processes and related regulations documented and communicated to your clients, to your staff. It also ensures that employee understand how to respond in advance to unforeseen events. So if you have a fire safety policy, it is easier for your employees to understand what are they supposed to do, God forbid, if there's a fire outbreak. Okay, and it also reduces the likelihood of inappropriate action. If I have a policy in place, if my organization have certain set of policies and underlying procedures in place, I will know what is expected from my management, from my side, to handle a certain scenario, handle certain situation. I don't need to take decisions from the information I have from the top of my mind. I have a solid policy and underlying procedure in place, and that will guide me to take appropriate action. It also serves as guiding principles in decision making and reflect organizations mission, vision, goals and objectives. Okay, so this is the importance of having policies in an organization. So without having a policy, without having policies and corresponding procedures, an organization will be vulnerable to threats and risks. So in this slide, I will tell you how policies act as a central force or center point or a glue that articulate or enhance a culture of governance, risk, and compliance. Okay. By developing policies, it is a mandatory requirement that an organization or a department, when they develop policies, those policies and procedures must be in line with the organization's overall objectives, goals, mission, vision, etc. So there shouldn't be any contradicting information in your process. So this is how policies articulate a culture of governance in an organization. Okay, so it will tell you, as I mentioned earlier, it will tell you what are the do's and don'ts. It will tell you the responsibilities of different stakeholders involved in a process. It will be in line with organizations overarching objectives, goals, mission, vision, etc. So this is how having policies an organization can enhance a culture of governance. Okay, second point is about articulating a culture of risk or risk management. So as I mentioned in my previous slide, policies as per the current best practices from the field of policy management, policies are also known as risk documents. So by implementing policies, the policy owners or an organization is trying to control certain risks. Okay, so please keep in mind that just developing a policy will not control your risks. Okay, whereas the beauty of it lies in its implementation phase, in its monitoring phase. So you write a policy, and you will have your controls listed down in the procedures, and by implementing those controls you are trying to keep your risk level within an acceptable limit. Okay, so this is how policies or internal regulations act as internal controls in an organization. It also helps in articulating a culture of compliance. How policies helps in articulating a culture of compliance in an organization? I'll give you an example. Most of our healthcare organizations we are seeing now are going for one or other type of accreditation surveys, right? Accreditation status. So you might have seen how these accrediting organizations communicate their standard sets to the target hospitals, right? If you read the standard sets as is, you may understand it clearly because maybe you are working in quality department and you have close link to accreditation, and you have experience in accreditation, etc. But for a frontline staff, take an example of frontline staff. When they read this accreditation standard sets and requirements from their end, they may not understand it clearly, right? So what is a way out? Translate those documents or transform those information into a more understanding way as a policy and procedure. Okay, especially if it is a mandatory requirement, like a required organizational practice as you see in accreditation Canada standard set. So you can make it as a policy and lay the underlying procedures and communicate it to the staff. Then it will be easier for understanding and it will be easier for implementation. So this is an example I can give you on how, or to show how policies articulate a culture of compliance in an organization. So Accreditation Canada is an example, JCI standards is an example. Apart from that, some ministerial regulations requirement, all this information are to be translated or transformed into policies and procedures and give it to your staff, communicate it to your staff. For example, medication dispensing or medication reconciliation, it is a required organizational practice as per Accreditation Canada. So if you read the medication reconciliation requirements and standards at ACES, you will not understand anything, or staff will not understand anything, whereas they will understand when you create a policy called medication management of medication reconciliation process and provide the procedural step. Ask them what is their tell them what are the expectations from them when they carry out a medication reconciliation. Then it will be crystal clear for them. So this is how policies articulate a culture of governance by linking it to the objectives, mission, vision, goals, etc. A culture of risk by linking it to the underlying potential failures or risk and setting controls through the policy and procedures, and articulating a culture of compliance, as I just explained. So this is the important element to be considered in all organizations where they have to have a robust GRC environment. Okay, that is what all about policies and policies as a document. Okay, now we will see what is the importance of policy management. What is policy management? In many organizations, there is no a structured department or structured team or structured entity that handles or manage policies. Okay, in big organization especially, it is very important. Why? Because if it is if it is a big healthcare organization which has multiple departments, if they write their policies on their own and manage on their own, their the styles will be inconsistent. One department will make in one template, another department will make in another template as they wish, and there will not be any authorization, and there will not be any ownership, proper ownership assigned, and the policy life cycle will not be managed effectively. There will not be any proper review process, no mapping to exceptions or incidents, no mapping to risk, no cross references to standards, laws, and obligations. So this is these flows or these gaps can be addressed by having a central entity to manage policies. So they are called policy management team, or a department that can manage or oversee this activity and act as a gatekeeper. So that is the importance of having policy management function or policy management capabilities in an organization. Okay, so these are the 10 principles, universal principles of policy management. Now we have seen policies, why it is important to have policies in an organization, why it is important to manage it appropriately, and now I am going to tell you what are the principles, universal principles of policy management. So these are the universal principles of policy management as adapted from OSEC International. I'll provide you with the reference materials at the end of the session. You can go back to those reference materials and read through it to know the details of whatever points I'm discussing here. Because of time limits, I am not able to go into the each and every details of these concepts and principles. But it is a huge and vast area which is worth exploring. Okay, so first principle is policy management is necessary to enable governance, risk management, compliance. So this I have already explained to you. And before I move on to the principles in detail, there is no, if you can follow this 10 principles of policy management. In addition, if organization has its own principles to manage their policies, that can also be included here. Okay. So second principle is policy management must be tailored to fit local context, objectives, values, and strategies. Policies and policy management must be tailored to fit local context, organization's objectives, values, and strategies. Okay, you can write policies. For example, when it comes to policy writing, you can write policies referring to or using international best practices as references, but you shouldn't take this as is and try to develop a policy, whereas you have to make sure that information or content fits into your local context, and your organization's objectives, values, and strategies. Policy management must be integrated into business operation, although centrally managed. So I have mentioned what is the importance of managing policies, using a centralized hub. At the same time, these principles and these concepts must be integrated into business operation. Policy management must be people centered. You can include your employees, frontline staff, your clients, even third parties when you develop or review your policy. Depends on the scope of this document. Okay, so they will help you in identifying your areas for improvement. They will give you a fresh eye perspective. Thus, you will be able to improve your process and underlying policy and procedure. Policy management and policies are expected to be high performing. It will be high performing when it is supported by needed resources, and it is effective, resilient, and efficient and agile. Okay, policy management must be standardized across the board. So by having a policy management entity in place, you will be able to standardize the process of management of policies in your organization. At the same time, by writing policies, by developing policies, an organization is trying to standardize the processes also. Okay, in multi-centric organization, if you have a policy in place, so the employees are expected to follow the same procedure or the policy in each and every branches of that main entity. Okay, so this is called standardization. As you all know, standardization is known as one of the main pillars of quality improvement and patient safety. Policy management must be collaborative as needed. If, for example, one HR department is developing a policy, okay, and when you go through the details, or when you go through the process details, you see that, or the HR department identifies that operation department has a major role to play in the implementation of this policy. So immediately seek their support, seek their input, and make the policy in a collaborative manner. Okay, then accessibility. All policy documents, all governing documents, all of these regulatory documents must be accessible to all of your staff. So it should be available somewhere that is accessible for all employees in an organization. Policy management must happen by engaging your employees as well. So as I mentioned in point number 4, principle number 4, this is similar, and this is by engaging here means proper communication, and you can involve your frontline staff in the review and development of your policies. At the end, last but not least, policy management and policies must be dynamic in nature. Especially healthcare organizations are considered as complex organization, and it is dynamic in nature. So it is not static in nature. So whenever there are changes happening, whenever there are improvements happening in a process, that changes or improvements, changes in risk profile, sometimes changes in objectives, etc., must be immediately reflected in the corresponding policies and procedure. Otherwise, what will happen? The gap between work as done and work as imagined will be huge. That will definitely jeopardize the safety of the whole organization. So these are the 10 principles of policy management you must follow when you develop and implement policies. So these are the policy management capabilities expected to be present in any organization that is, that is aspiring to, or that is trying to establish a policy management function, and effective policy management process in any organization. There should be a governance structure for the policy management process itself, by establishing a governance structure, who is responsible for what, and who will approve the policies, who will approve the policy management processes, etc. And there should be a policy on policy that is considered as policy management standards in an organization. That document should govern the process of policy development, review, approval, implementation, monitoring, etc. And in the development phase, so policy management, when policy development happens, whether it is a new policy or revising an existing one, there should be a standard process to be followed. There should be some standard templates to be followed. And regarding communication, it is an important pillar in policy management. Whatever policies you develop or whatever changes you do in your existing policies, it must be properly communicated and trained on to the target audience. Okay, enforcement means it is also can be considered as an implementation. When you develop a policy, you communicate it and you have to implement it. So by just writing a policy and keeping it in your shelf, policy will not serve its purpose. It will not act as a risk document. It will not protect the organization from unnecessary liabilities. Implementation or enforcement is an important element to be considered. After implementation or enforcement, there should be assurance function or monitoring function also to be activated. Okay, then comes the improvement phase. So there should be a process in place or methods in place to periodically review and improve, and sometimes retire or make policies obsolete based on the conduct. So this is the last, but last phase, or one of the capabilities that is considered as a last element. As you see here, it is a cyclic thing, so there is no stop passage. That's why I was a bit hesitant to use the term last. It is a continuous cycle. Okay, so these are the main policy management capabilities that is to be established in an organization. So here I will show you our policy management cycle. Okay, so it is just it is not a mandatory requirement you should have this categorization as this is just a proposal to have a policy management cycle in your organization. The policy documents can be divided into administrative or support policy documents and clinical documents, since it is a healthcare organization. Then based on its applicability, these policies can be further divided into organization-wide policies, departmental-wide policies, or service-specific policies. Whenever a department identifies a need to develop a policy or revise an existing policy, this should undergo a development phase or authoring phase or development phase. Once it is developed, it should undergo review by needed stakeholders. Then it will go for approval. Implementation is also called enforcement, then evaluation, realignment, and so on and so forth. So this cycle, I would like to compare it to our Deming cycle, plan, do, study, act cycle. If you look into this cycle, so this can be considered as a plan, do, study, act cycle. So PDSA cycle. So this is also can be considered as a quality improvement activity. So this is how policies play an important role in the improvement of quality of service. So this is applicable for new policies. This is applicable for existing as well as new policies. So policies should be developed or authored by a party. It should be reviewed by relevant stakeholders, approved by the authorities, implemented, evaluated regularly. After evaluation, if you find something to be changed or realigned, so realignment should happen. Then again, it should go through the review, approval, implementation, so on and so forth. So it is also a continuous cycle of improvement, same like our PDSA Deming cycle. Okay, so that is all about the importance of policies, policy management, importance of policy management capabilities, policy management principles, policy management life cycle. Now we will see the importance of having or establishing a policy management process governance structure. Okay, so as you have seen in that capability model, governance is the first element. So there should be a governance structure in place, right? When you try to have an effective policy management system or process in your organization, first step is to establish a policy management governance system. Okay, how can you establish a policy management governance system? You have to establish, or you have to have a team to oversee this policy management activity. You have to assign responsibility to this team. So some organization I have seen while I was going through the best practices and different articles related to policy management. Some organizations have a specific department or a team that handles or that oversee or that act as a gatekeeper of policy management activities. Whereas other organizations, they have some standing committees. So committees will do the function of this team who is acting as a gatekeeper. So either way, it should be fine. But having a department, it will be like forever kind of thing. Committees, the members can change. I'm not telling one is good over the other, but these are the different options you can have. when you try to establish an effective policy management governance structure. Okay, first of all, you have to have a governance structure and management team. Then you have to develop a policy on policies to guide the design and operation of policy management processes with standardized forms and process. So to write a policy, to develop policies in an organization, you must have a policy on policies. Okay, so this is also known as meta policy. So basically this document will tell or guide your employees or policy owners or policy developers on how to write policies, what is the scope of policy development, how to get it reviewed, how to get it approved, who are to be included, depends on the scope of the document, what are the forms you have to use, etc. Okay, so first point is about determining the governance for the policy management system. So we have to establish a policy management department or a committee to govern the policy management activities, define the scope of this process, what are the inclusions and exclusions that coming under the scope of this particular department or a committee. There should be some templates and guidance documents, procedures, etc. to be developed and approved by this entity. Then you should include representatives from different departments to be part of this committee or the department. Okay, and then you have to assign roles to the policy development and development review and approval team members. There should be policy authors from different departments. There should be an owning department, right? But I would like to clarify one more thing. By establishing a policy department or policy management team, you cannot give them the responsibility to write policy on behalf of the different departments, because they may not have the expertise to write policy on behalf of certain department, especially in healthcare organization. Sorry. Okay, so there must be policy authors from the proposing department or owning department, and that department should be responsible to make sure this policy is being implemented and monitored properly. And there should be policy contributors or reviewers from different departments and approvers from the senior leadership team. So this is how you can establish a governance structure for the effective management or the establishment of policy management processes in your organization. So standards or policy on policy. Okay, so this is another requirement you should have. Once you establish a governance structure, this department or this entity must develop a meta policy, that is called policy on policies. That document will act as a holy book for the whole organization, that will guide them with the required regulation they are required to follow when they develop or approve a policy. And this will help them with using the templates, standard approved templates, different forms, etc. So this is also called meta policy, as I told you. So that document will govern policy writing process, approval, management, communication, etc. This will develop decision making guidance. It will establish policy management process, design different policy templates, develop standard documentation, improvement, and policy retirement. So all this information will be communicated to the organization, to the staff, through this policy on policies or meta policies. Okay, so that is about establishment of policy management governance structure in an organization. Next thing, now you have a structure in place. Now you as a process owner, you have to develop a policy. So you will directly approach this policy management gatekeepers or policy management committee or policy management department and tell them, okay, I would like to develop a policy. Okay, and this is the topic, so on and so forth. So there may be some process to be followed. Sometimes you may need to submit a request form. You may need to undergo certain discussion with this committee or team, etc. So if you're starting from scratch, you don't have any policies in place. You have zero policy. You are a new organization which is trying to establish a policy management process. Okay, first thing you have to do is a situation analysis or a situation assessment. Okay. So what is a situation assessment or situation analysis? First, you have to determine the need for policies or revising an existing policy. Okay, so taking into consideration policies that already exist in our organization, other controls addressing the topic, the significance of the objectives being supported, and risks being addressed. So In a nutshell, you are trying to do a need analysis. If I really need to develop a policy, is the proposed policy is going to control any risk? Is it linked to, is it significant, etc. So these are the things to be considered when you develop a a policy. Okay, then you have to develop policy using the user guide, a policy on policy, and get input from relevant parties. Okay, so, first phase in developing and approving policy is a situation analysis or a need analysis, right? So, you have to, first of all, you have to develop a list of policies required by mandates, standards, and voluntary commitments. This is an important thing or important step to be done. For example, you are going for an accreditation activity, okay, and you have the standard sets in place, and you know what are the policies or procedures or SOPs or guidelines that those are required as per the standard sets. Okay, there may be some standards saying there must be a policy and procedure in place to manage medication dispensing policy. So it is mandated by this particular standard and criteria. You have to extract list of those requirements from the standard set and prepare a list of needed policies as per the mandates. Okay, accreditation requirement is one of the examples. There may be other requirements also, as I mentioned previously. There may be some legal and regulatory and ministerial requirements. So you have to extract all those requirements and prepare a list. Okay, so there is no way out. These are the mandatory requirements. But at the same time, there will be some voluntary commitments also by the department or the directorate. Maybe they will decide, okay, there is lack of clarity around this process. So I would like to clarify this procedure or process to my staff by creating a policy and a procedure. At the same time, they are required to map it to not necessarily to the mandates or standards, because there may not be any. It is not necessary to have mandatory requirement as set by some standards or regulatory requirements for all policies, but there should be a risk and controls underlying to it. It should be mapped to the organizational objectives and risks. Okay, if it is a policy, if it is an SOP or a guideline, you can still go ahead. Okay, it is not mandatory that you must link or map your SOPs or guidelines to risk, but if it is a policy, it is a mandatory requirement. Okay, then you develop a list of desired policy, then identify interrelated policies and its relationship. Sometimes by developing two policies, maybe it is redundant. Some information will be redundant. Maybe you can club them together and create one document for this. So this is a kind of gap analysis you will be doing. Okay, then you will determine redundancies, overlaps, gaps, etc. Okay, so these are the key questions you should ask before you develop a policy, before you go ahead with the revision of an existing policy. Okay, what objectives are we supporting? So you are trying to map your proposed policy or proposed policy change to the organizational objectives. Then you are trying to link it to requirements or mandates, laws, regulations, some contracts, third-party contracts, other obligations, standards, etc. Then you will see what aspect of the business are going to be affected by the policy. So which part or which process is going to be affected by this policy. Okay, then you're going to see by developing this policy and implementing this policy, am I going to enhance performance or improve operations? Then I'll see if this policy is linked to a high risk process. Okay, and then I will see, or you will see, do I already have a policy in this area? If I have a policy in this area and I have to add some process change to it, then I shouldn't develop a new policy for that. Having too many policies will add burden or burden to an organization. So it is very critical and crucial to understand or analyze the need to develop a policy by doing proper gap analysis and situation assessment. Okay, and mapping it to the mandates, risks, etc. Okay, once you identify the need and you agree with the fact that, okay, I must develop a policy because it is relevant and it is linked to, to risk and it is a mandatory requirement as per standard set, etc. Then you have to approach the centralized policy management team. Then if they approve it, they will also do their own analysis from their end, and if they are also convinced with this approach, they will give you a green light to go ahead and write a policy. Okay, then you have to develop a draft of the policies. How are you going to write policies? You cannot write policies or develop policies in a template that is not a standardized or approved template. You cannot use templates haphazardly from the website, from Google or anything. You have to have, your organization must have a standardized template, as I mentioned in my previous slide, and underlying forms to be used when you develop a policy. So you have to write your draft in that template only. Then collaborate and gather input. Then design and prepare your policy. Then you have to review the policy, and all of these reviews must be documented. Then once it is done and finalized, seek approvals. In developed organizations, big organizations, they have a centralized hub or a system to manage this process. So everything happens online. So there will not be any paper hard copy businesses. So everything, all the reviews will happen through the system. It will be easier to track the history. It will be easier for the publication. It will be easier to provide access to the employees. I believe this is considered as a cutting edge technology you can use when you establish a policy management structure in your organization. Better to have it online, right? So it is worth investing money in this area, basically. Okay, so when you develop policy, you must take these points into consideration. So a good policy document must be beneficial to your clients and staff. So when you write policy, there shouldn't be jargons or complicated terms that is not going to be understandable for your frontliners or your target audience. So please try to minimize such jargons. Make it simple and straightforward. It should be, otherwise it will not be beneficial for your clients and staff, basically. So it should be consistent with the legislative authority. As I told you, it should be in line with organization's mission, vision, goals, objectives, etc. There shouldn't be any contradicting information in your policy you are developing. It should be adapted to organization's culture and values. Must be evidence based. You cannot find information or add information that is not a best practice, because it is regulatory document you are developing or a governance document you are developing. So it should be within the organization's resource capacity. You shouldn't develop a policy and try to implement it when there is no buy-in from your leadership team and there is no resource mobilization happened related to this policy. And it must be easy to interrupt, and it should be adapted to the organization's functions and settings. A policy statement must state what shall or shall not be done. It should include what the rule is, when it applies, and who it covers. It should provide reference to any underlying procedures or guidelines. So sometimes there may be policies. When you develop a policy, when you write a policy, there may be some policies that are existing in your organization that must be read in conjunction with your proposed policy. So that those references must be provided in your policy. So that will be easier. That will give a comprehensive information for your staff. And you must identify how you are going to monitor the effectiveness of this proposed policy over time. There should be some metrics identified, some data measures identified in line with these policies. Okay, that is about the policy. And procedures are defined, are step-by-step instruction that will tell your staff on how to carry out certain tasks. So procedures are expressed as series of activities, okay, or steps that are written in a directional fashion. Those are to be written in a directional fashion to achieve the desired objective of a policy. So that will tell your employees what is expected. For example, sharp disposal policy. Okay, the policy statement can be sharp must be disposed in specific containers. Okay, how to dispose sharp in the designated container. So this is the difference between a policy and a procedure. Procedure must follow a chronological order. It should be written in a step-by-step manner with the timelines, sometimes as applicable, and responsibilities as well. So it is not recommended to have a roles and responsibility part in any policy documents. Rather, It is highly recommended, or it is a best practice to include or integrate these responsibilities within the procedural step itself. For example, the nurse is expected to dispose the sharp in a sharp container, immediately or within stipulated timeline, or to avoid any sharp injury. Okay, so this is how a policy and underlying procedures should be written. Okay, so next phase in policy management process is its communication and training. Okay, so in the previous slide we have seen policy authoring, development, and approval. Once it is approved, it should be accessible to all staff in your organization, and even though it is accessible, you cannot simply sit and assume that okay, my staff will read the policy, they will know the policy by heart, they will understand everything. No, as a policy owner, it is your responsibility to develop a proper communication and training plan. Okay, especially if it is a mandatory policy or mandated by legal and regulatory and accreditation requirement, it is a must to have proper policy communication and training plan. Okay, policy communication cannot take one size fit all approach. Okay, depends on the scope of the document, depends on the risk exposure, or depends on the impact of the policy or the risk it is covering. The training program and communication program must be adapted to that particular context. Okay, and the audience of this communication and training must be defined on a risk related need also. How can you decide that? Based on the risk exposure. For example, if you're developing a policy and you have already identified the underlying risks and controls are being set in the procedures. Okay, so if there are 3 or 4 type of target audience for this particular activity. Okay, medication administration policy. Okay, so nurses are frontliners. I mean, nurses are the one who usually administer medication, so they are one of the target audience. So their risk exposure to needle stick injury, or something like that, is higher than the physician who is also part of this process, right? So their training based on the risk exposure they are facing, or who are at the sharp end of the process, they should have in-depth training program. Okay, so this is just an example. So this is how you have to prepare your training and communication plan based on the risk related context, in a risk related context. Okay, next one is just-in-time training or policy reminders. Just-in-time training is once you develop and publish a document, there should be a communication and training plan. At the same time, for an existing document, if you notice that there are gaps in knowledge related to a policy, there are some incidents are keep on repeating or recurring in a particular area where you already have a policy, you can initiate a just-in-time training and policy reminders. So that means you have identified a knowledge gap among your employees. That is why it is resulting in a materialization of the risk, underlying risk. So in this case, you have to have a just-in-time training program. Okay, so first of all, to develop or implement the communication and training plan, you have to have a communication planning team if you have, or the policy audit department itself can be this planning team, and the stakeholders, related stakeholders. And you have to have needed communication plan element, apply risk-based need assessment as I just explained to you, and all of these things to be documented, and you have to provide access to policies and training, and training delivery documentation. So these are the different steps involved in the implementation of policy communication and training program. Next step in policy management is policy enforcement or implementation. When policies exist but are not enforced or implemented properly, then the organization is exposed to liability on many levels. As I told you in the beginning, if you develop a policy and keep it in your shelf or upload it in your system, assuming that, okay, I have developed a policy, now I can relax. No. Policy development or policy management doesn't stop by just writing a policy and getting it approved and published. It is your responsibility as a policy owner to make sure it is being properly enforced or implemented. You have to establish tasks, methods, and processes for implementation of policies, exceptions, enforcement, and assurance of policies. Assurance monitoring is another important element to be considered when you implement a policy management structure and policy management process. There must be defined and documented implementation plan and enforcement actions. Policy enforcement involves all three line of defense in an organization. You know what are the three lines of defense, I hope. So first line of defense is your frontline staff who implement the policies, or who are the active participants in the policy or process. Second line of defense is the management team who oversee the implementation, who makes sure the needed resources are in place, communication is happening, training is happening, etc. Then the third line of defense is the auditing team, or internal auditors, or quality management team, sometimes surveyors, internal surveyors, external surveyors. So all of these parties are equally involved in the policy enforcement. Okay. So these are the steps involved in the policy establishment, or enforcement or implementation phase. This I have already explained to you. So there should be a compliance enforcement task, there should be an assurance team, and these are the key parties play a role in the enforcement and implementation of policies. Compliance and ethics department, maybe they will or this is in addition, you have to know that this depends on their involvement, depends on the scope and the content of the policy. Not necessarily all of these teams should be should take part in the policy implementation or enforcement. That all depends on the scope of this particular document. Sometimes we have to establish an extended enterprise enforcement. Extended enterprise enforcement means sometimes third parties or contractors are part of your policy conducts. In this case, you have to involve them also in the implementation and monitoring. Last but not least phase in policy management is policy effectiveness analysis and improvement. Each policies must be reviewed periodically, and upon certain triggering events, the need for revision must be considered. So policy, as I mentioned in my previous slide, it should be dynamic. Policy management should be dynamic, policies should be dynamic. So whenever there are changes in the context, whenever there are changes in risk profile, whenever there are some recurring incidents, then you have to analyze the policy. No need to wait for the expiry of the policies. Call for an interim review and improve it, review it, etc. So it shouldn't be a static thing. Okay, and there should be a certain time period you should set as a maximum period of 2 years or 3 years to keep a document or keep a policy as is, and after that it should be a mandatory requirement to pull the document and review it. Okay. And sometimes in addition to the policy review, sometimes our policy management process itself may need some changes. So that process itself and the meta policy itself also should be should be reviewed periodically to make sure it is being implemented or carrying out in an effective manner. Okay. To enable such reviews and improvement, there must be some metrics or data or a monitoring plan in place to monitor the effectiveness of your document and your processes. Okay. Then sometimes some policies may need to be retrieved based on the context. For example, if a process, you have a policy to manage or regulate a process, and you think that or not think that process has been abandoned for some reason. In this case, you must obsolete that the related policies, procedures, SOPs, guidelines, etc. There is no point in keeping a policy for something that doesn't exist. And you have to maintain history. You have to maintain the changes happening in each revision of the document, etc. And if it is happening through the system, it is easier to extract the history and pull the reports, etc. Okay. Once you review the document, then next step in PDSA, if you remember that, this next is realignment based on the changes or based on the findings from the test phase, okay, or effectiveness analysis phase. Then you have to modify your process, and the underlying policies depends on your findings from the effectiveness analysis phase. So it will help in the improvement. So this is how policies act as a tool to enhance a culture of quality improvement in your organization. So policies, when you say policies, earlier time there was a concept that policies are not at all important. Those are just papers. It's always considered as the least thing when we think about risk management, quality management, etc. But now, based on the recent research studies we are seeing in the field of policy management, policies are considered as risk documents, strong documents, regulatory documents. It is very important to establish a strong and effective policy management process in any department that is aspiring to improve quality of service, patient safety, staff safety, etc. Now we have seen the importance of it. But having said it, please make a note that by just writing policies, this will not help you in any way. Okay, rather you have to have a proper implementation plan, monitoring plan in place. Okay, so and it should happen in a periodic manner. Now I would like to take you back to the previous cycle, policy management cycle I have shown you. So this is the policy management cycle that is closely linked, or this is similar to our Deming cycle, PDSA cycle. So planning phase is this, implementation, do, study and act. So it is a continuous cycle. It is a continuous cycle of improvement. So there is no stopping. Okay, so this is the previous slide I have shown you how policies act as an enabler or a tool to integrate governance, risk and compliance elements in an organization. I have explained to you how it acts as a governance document by linking it to the objectives of an organization and analyzing the depth or impact of each and objective, and thus weigh the value of a particular policy. Then risk, how can you link policies to risk? Then a culture of compliance, how can you link policies to standard set? So this is a mapping process. So if you map your policies or proposed policies to all of these elements in your organization, you will be able to have a robust policy management system or a framework that will help an organization in enabling its governance culture, risk culture, and a culture of compliance. Thank you so much for your participation. If you have any questions, feel free to ask me. I hope whatever I have explained to you have provided you with some enlightenment about our policy management process, especially for the healthcare organization, and how it enhance quality of service and patient safety. Thank you so much.
Thank you, ma'am. Thanks a lot. Lot of new lessons for me. Even for policy management, we can use PDCA cycles. Excellent. Yes. But I have some questions. I have some questions from your presentations. Is there any timeline for policy update, ma'am, as per JCS standard? Or
yeah, certain standard sets have set some timelines for the review of policies. For example, Accreditation Canada set a timeline of 2 years for lab documents to be updated in a two years time period, whereas
every 2 years, correct?
Every 2 years, yes, that is the timeline set by Accreditation Canada for lab documents. And for radiation safety documents, they set the timeline annual review cycle. Okay, so these are the specific requirements or mandates as per certain standard sets. Okay, in addition, each organization should define their own time period to review and update policies. So the policy shouldn't be left as a static document. It should be a dynamic document. Whenever there is a trigger, you must update the policy. There is no question about it. But at the same time, you must have defined a timeline to initiate a review and update of policies. So maximum of, in my organization, the maximum time period to review a policy is 3 years. Okay. If it's an existing policy, if it's a new policy, that must be reviewed after 1 year, because this 1 year period, since it is a new document, we are giving it as a piloting period, and after 1 year you should pull the policy and see if there are any changes happened. Then you have to reflect those changes in the policy and keep it for next 3 years. That's the maximum time period, but interim reviews are also allowed. Hope it is clear.
Yes, ma'am. And as per research, still there is no significant compliance, especially from healthcare. The percentage of compliance regarding policy very low. So there is no significant complaint. So what is your advice? How to increase our compliance and policy implementation?
Okay. So that is a good question regarding compliance. As I mentioned in my throughout my presentation, compliance monitoring is an important pillar to ensure effective policy management. So if there is a compliance issue, as policy owner or policy owning department, it's your responsibility to dig deep into the causes of non-compliance. Maybe
Okay.
the process is not feasible for them. Maybe there are no resources available to carry out the procedure as set in the policies and procedures. Maybe some other reason, or maybe they themselves might have find some way, some bypass process, some variation from the procedure. So all these things should be dig deep and find out. Sometimes, as per recent researches we have seen, some variations are still allowed if it doesn't jeopardize the safety. You can still allow some variation from the procedure, some certain level of variation, but that is very critical and sensitive. At the same time, we are telling staff to follow to the procedures and policies to the letter. Sometimes they may vary. They may find some bypasses and some tweaking here and there. If you analyze this process and see, okay, they are doing some variation from the procedure because of A, B, C, then you may have to adapt it if it is enhancing a safety, and if you think that it is not, their variation is not jeopardizing the safety, right? So first of all, you have to see why there is non-compliance, why there is incidents related to non-compliance. You have to dig deep and see. So this is
This is like investigation. We need to do investigation, correct?
yeah, exactly. You have to do an analysis. We usually don't call investigation. We
Okay.
prefer to call it as an analysis. Yeah.
Okay. Okay. Good.
Yeah.
And actually, who is the one responsible for policy? Because you mentioned that we can establish policy management team, but
Mhm.
is it possible to establish separate team under quality for policy preparation?
Yes, actually, there is no set on stone rule that a policy management team must come under quality department, even though policy management team is, as a policy management process, is closely linked to quality improvement
Because
and patient safety.
as per your presentation, we need to do PDCA. We need to collect data about the
Exactly.
complaint. So
Exactly.
if it comes under quality, probably we can do all
Exactly.
these things, correct?
Yes. Yes, yes, I agree with you. It can come
Yes.
under quality, but it can come under, somewhere above or above. I mean, somewhere higher in the hierarchy also can be,
Yes.
because we are dealing with regulations. So they can come directly under CEO office, directly under managing director's office also. So how you place your policy management, because that will give them more strength and more authority. Okay, I'm not telling, or I'm not conveying the message that having policies under quality department will not give them the needed power. It will also happen, because quality management team and accreditation team, they are the third line of defense. They are the one who is monitoring, surveying, accredit, all these activities being coming under them. So quality management department is also a good fit for policy management.
Now we need to know which one is more effective.
Effective in the sense, having policy management department under quality department is effective because
Mhm.
when you map your policies with accreditation requirements, etc., it will be easier for, when it is under the same team, it is easier for the
Exactly.
management. Whereas we are
Exactly.
also
Yeah.
linking, yeah, because most of the organization risk management also comes under quality department. Okay, so
Yes.
we are trying
Yes.
to, when you try to map, or when you do the mapping of your policies with the risks and accreditation requirements, it will be easier for you if you are in the same team. Easy to work.
Excellent. Yes. Yes.
Okay.
Thank you. Thank you, ma'am. Yes, ma'am.
Good evening, ma'am. This is Jessica here.
Hi, just
Very well explained, very enlightening, ma'am. Thank you so much.
thank
I
you so much.
just wanted to ask you, ma'am, is there any structured body for the policy? Do we have a structured body? Like,
Mhm. Okay. Structured body in the sense, okay.
We have AHRQ, IHI for patient safety. Is there any international organization for
Okay.
policy
Oh,
management? Yes.
yeah, definitely. Okay, I will. For this, definitely there are some organization like Open Compliance and Ethics Group, OSEG,
Mhm.
and GRC 2020. And so these are few organizations doing research in the field of policy management, and whatever information I have shared with you, I have taken from these websites, and I have done a certification from OSEC, that is around the topic of GRC. I am a GRC certified professional, and currently I'm doing a policy management pro certification, that is also from OSEC. So these are excellent resources you can use when you try to establish a policy management structure in your organization, and they have a cutting edge information, and they will help you from A to Z. They have some consultancy services also, they provide training consultancy, but they are towards an expensive side. But if you do some courses like this OSEC has a course called Policy Management Pro. It is a certification, certified professional in policy management. So so that is I have never seen any organization providing such a certification in the field of policy management. So it's an excellent course you can do if you are interested to know more about, dig deep into the policy management concepts. I can share these details with you post session.
Yeah, please.
Sure.
Thank you, ma'am.
Thank you.
Thank you.
Thank you, ma'am. Thanks a lot for your presentations.
Thank you so much. I would like to thank each one of you for your participation, and I couldn't thank enough RISI for this wonderful opportunity given to me. I am looking forward to for more collaboration. Thank you so much.
Sure, ma'am. Sure, we'll do more collaboration in future.
Definitely.
Thank you, ma'am. Thank you all for your continuous support. Good night.
Thank you. Good night.